Hello and welcome to Elevation 740. Today I have Ed Freysinger, the CEO of St. Joseph Regional Medical Center. Thank you so much for coming and joining us today.
Well, thanks for having us here.
So my first question is, why St. Joe's? How did you end up here and what brought you to this part of the world?
Well, what brought me here, quite frankly, is the community and the people we have at the hospital. Mm-hmm. As we start this conversation, I just want to make sure I recognize and thank my employees, my physicians, my volunteers, my board, in that, because healthcare is a team sport. Mm-hmm. And I'm just very, very proud of my team. Mm-hmm. And so what drew me here is that team. Mm-hmm. And through the efforts of our team, we've been able to continuously address and improve quality and service in our community. Mm-hmm. And recently, we've been recognized as an A-rated hospital through an organization called Leapfrog. Mm-hmm. And there's only 6 of us in the state of Idaho that have been rated at that level.
Well, congratulations. That's a huge honor.
And our cardiology program has been rated a platinum level, and that's based upon the performance that we have in our cardiology services. Mm-hmm. And then for the third year in a row, our OB unit has been recognized by U.S. News and World Report as an outstanding OB unit for quality and service.
Well, that's really exceptional. So congratulations on that, too.
Yeah. So when you ask what drew me here, it's the people.
Mm-hmm. And how long have you been doing this sort of work?
Well, I'll be celebrating 40 years next year.
And congratulations again.
Yeah. I'm fortunate. I kind of followed in a family trade. My father ran hospitals in the health system back in Michigan. Mm-hmm. And I've just had the privilege of being in this profession basically my entire career. And I'm here at St. Joe's, and I've just celebrated actually my 3rd year.
Well, congratulations, and thank you for being here serving our community. So I'm curious if you could tell me a little bit more about St. Joe's and the role in the community. It is you're a trauma 3 medical center. Yeah. That is a really big deal. So tell me more about what that means.
So St. Joe's is, as our name says, we're a regional medical center. Mm-hmm. And what that refers to is we receive patients from basically almost from here to Boise is 5 hours. From here to Missoula is about 4 hours. From here to the Tri-Cities is about 2.5. And then, of course, to Spokane, Coeur d'Alene's too. Mm-hmm. And we're the only...
And what about Oregon? Oh. Because I'll tell you, I was driving along in Asotin one day, and I saw there was an ambulance from Wallowa County. Yep. And I was like, what on earth are they doing here? Oh, that's right. Well, they're going to St. Joe's because that's where the trauma center is.
We receive patients from a broad geographic area. Mm-hmm. Overall, it's about 170,000 people that are in our catchment. Mm-hmm. And as a level 3, what that means is that we are certainly open 7 days a week, 24 hours a day, 365 a year. Mm-hmm. But we also have services available 24/7. Whether that's our general surgery, OBGYN, orthopedics, and other programs. Mm-hmm. But we're also a level 3 trauma plus. And, we're very, very fortunate here in the Valley because we not only have the services that are required for a level 3, we have some additional services.
So what are those sorts of services?
We have an interventional radiologist, and that's Dr.
What's
Ho.
that? Well, I don't even know what an interventional radiologist is. That sounds like...
What he does is he performs procedures on the peripheral limbs in that of the patient, but he's instrumental in caring for patients that come in with different blood flow issues, etc. But we have Dr. Ho here, who is just exceptional here. Then we have a full-time cardiologist here, and that's Dr. Kim. Mm-hmm. We are STEMI certified as well as stroke certified, and that's above and beyond our level 3 trauma status. And then, of course, we have Dr. Solnick, who's here, who's a neurosurgeon.
Wow.
And so when you look at our level 3 trauma, we have level 3 trauma plus.
Right.
And that's quite frankly unique for a community of this size and scope.
That's really exciting. So just to back up a little bit, so if we have a stroke specialist here, does that mean, so if somebody has a stroke, let's say they're out in Grangeville or Wallowa County or something, then they can get in an ambulance or something, and they would come here, and that's still enough time, presumably, that they can be treated and have a successful recovery.
Well, yes, certainly you want to get here as quickly as possible. And with us having those services available, that shortens the travel from potentially to here or up to Coeur d'Alene or other places. And in many instances, they may actually be flown here via the helicopter to shorten that time frame.
And so do you have any examples or just anything like, what are some of the stories that stand out to you where we have served this critical need for a particular patient?
Yeah. Without going into specific patients, we have those on a daily basis. We see anywhere from 40 to 60 patients a day in our emergency room. And we have those on a regular daily basis. And those are 24 hours a day, 7 days a week. And, again, we're just very fortunate to have that. And when we look at some of our performance standards, we're performing at or well above the standards. There's what's called time to balloon. So when a patient hits our emergency room and gets to the cath lab, and the balloon, which is a piece of equipment that is used to help save people's lives, the standard is to get in within 60 minutes from that time.
Like a whole hour.
Yeah, an hour by the time they hit the door at the hospital.
So basically, I walk in, and then I have an hour to get to the.
And our balloon time is less than 30 minutes.
Which is amazing.
Yeah.
Because I'll tell you, in other areas, that is just simply not the case.
We're very fortunate to have, again, the team, the employees, and the caregivers that are able to perform at that level. I'm very proud of
when I've been to, since I've been to St. Joe's in the ER before, and I mean, it's true. I went in and I was seen probably within 15 minutes, I think. So.
Yeah, we monitor the time, for patients when they arrive to when they are treated by the physician. And, we set objectives and goals. And again, sometimes based upon, what's walking in the door and the demand, we have to triage our patients. And sometimes patients do have to wait a little longer than 15 minutes. But we do triage and try to move patients through based upon their need as quickly as possible.
So how have you actually been able to do that? I mean, what are the sorts of things that you then implement, practices, procedures to get that time down? I mean, that's really exceptional, and I'm curious how you did that.
Well, one of the majors is that we have a direct contact between referring institutions to our cardiologist. And so he's able to review what's going on with the patient and get our systems rolling before the patient even arrives. And so when the patient gets there and they arrive, we're able to move very, very quickly.
Okay. So I'm wondering then, given all that you're already doing, are there other things that you're trying to tackle, or kind of where's the future going? Are there initiatives that you're undertaking?
Yeah, we're continually evaluating and improving our services. We've been fortunate to invest in opening a brand new unit, which is called an acute rehab unit. Those are for patients who maybe have had a stroke and need rehab or orthopedic or other issues where they need a little longer time to go through rehab, physical therapy, occupational therapy, speech, and that. We just recently opened a 10-bed unit here, and it's staffed 24/7, 365. And with that unit now being here, people don't have to travel all the way to Coeur d'Alene or other places to get that
That's
service.
what I was wondering, is that it strikes me that whatever services we can provide here means somebody's not going to Spokane or going to Seattle or going to some of these other places in order to get care.
Yeah, and so that's why we're continually working on that. We've just recently replaced and upgraded our linear accelerator, and that's for...
What's the linear accelerator?
Well, that's used for radiation therapy for oncology patients.
Okay.
And we just recently upgraded our equipment there. We have one of the most advanced pieces now in the Northwest. We just implemented...
Wow, so maybe people are going to come here instead. We'll get some people from Spokane.
We've been able to increase what we can do locally so that folks do not have to travel. And as a matter of fact, today we just installed some new equipment to our new linear accelerator, and a treatment that would take up to 20 minutes, we're now able to do in less than 5.
Wow.
And so we've been able to, again, improve not only the access to services, but the speed in which we can treat our patients here.
Well, that's one of the things, honestly, that has been really interesting is just the pace at which medical technology has been, has that been a challenge for you to then get some of these technologies and implement them? Or what have you been able to do to get these sorts of things here?
Well, we're fortunate that, not only locally do we produce enough income to invest in capital. Mm-hmm. We're part of a larger system, and as a part of the larger system, we're able to access capital and take advantage of size to get some good pricing in that on some of the items, which helps us, expand what we can do locally. We also recently installed what's called a PET CT scanner. Historically, we had a van that would come for 2 days a week, and we could do up to 50 patients in a month. We're now able to do over 75.
Wow.
And so, again, those are patients that don't have to travel to get that service.
That's really exciting. Yeah. I have another question for you, and that was when I was just reading in the Tribune about in Washington, there's issues around maternity and hospitals being able to service rural communities. And I'm just wondering if you can speak to that. And is that the sort of thing that you're also struggling with, and how that might affect us?
Well, recruitment is always a challenge in healthcare. And, we work with other partners in the community with recruiting. So in OB, we work with Catalyst. Catalyst has the OB providers, and we work with them in supporting the recruitment and retention of OBs to help support care locally.
So this isn't going to be a problem here?
Yeah.
Good. Excellent. So I'm curious, what are some of the challenges then that you're facing as well in providing care?
Well, similar to other industries, when I talk to, other leaders in the community, supply chain is a challenge. And
you're not the first person who said that. No.
and recently there's been an issue across the country, and with one of the hurricanes that went through. It impacted the production and distribution of IV fluids across the country.
You're kidding me.
No. And so we stepped back as a team at St. Joe's, and we've implemented significant mitigation strategies. How do we use our IV fluids differently? But also we reached out to our partners in Scion. We're part of a company called Scion Healthcare, and they were able to send us IV fluids from across the country.
Oh.
And as a result of that, supporting us, because we are a regional referral center, we've been able to not just maintain, but actually increase some of the access to care here locally. Wow. So, again, I'm just very proud of not just my local team, because they've done Herculean work to identify and implement strategies to manage the utilization of IV fluids, but also our partners, both locally and nationally, that have supported access to care here. And as a result, patients have not had to have surgeries delayed in many instances, or services impacted.
Well, that's really exceptional. Just as a follow-up, so what are some of the things then, I'm just curious, what are some of the things then for this IV thing that you have been able to do in order to, reduce your use of, just some, I'm just curious.
Yeah. So, some of it is that they've looked at alternative ways of delivering fluids. And so where in some cases you would hydrate a patient using the IV. And what we're doing now in some instances is asking the patient to hyperhydrate before they come in.
Oh,
and so they just drink and they have the fluids ahead of time.
Yeah.
And so that's been able to help us mitigate, again, that use of the IV fluids. We've also been able to take larger bags of IV, and within our pharmacy, we're able to break it down into smaller packages. So where you may have used a portion and then the rest of it would have been wasted historically, we would break it down into a smaller package and then use that and have much, much less wastage.
Excellent. So it sounds like it's just a lot of problem solving of, we have a problem, team effort, let's collaborate and try to figure this out.
Well, I'm very fortunate. I just see what we get to do as a blessing, and we are full of brilliant people. And what I find is that when we inspire our brilliant people to be brilliant, they come up with brilliant options and ideas, and they implement them, and it improves overall effectiveness of what we do. And again, I'm just feel blessed to be able to do that.
Well, excellent. Well, thank you so much for your time here on the program. And I don't know if there's anything else you wanted to tell our community or viewers.
I just want to say thank you again for letting us come here. And I just want to say thank you to all of my employees, my physicians, board members, and volunteers. But I also want to make sure we recognize the other healthcare providers, because healthcare is a team sport. We work together to make sure that, again, as a healthcare community, we're caring for all of our citizens. So thank you.
Yeah. Well, thank you. And thank you also to our viewers for watching Elevation 740. We'll see you next time.